Good Monday morning, Dr. Nelson at News Talk, 640 WFNC Talk Radio. This is Ask the Expert. We're talking about chiropractic health care. And we're waiting on a special guest, Commissioner Wayne Goodwin, who is in favor of chiropractic care. Commissioner Goodwin understands the cost benefits of chiropractic. And certainly as the president of the North Carolina Chiropractic Association, I have worked to educate our fine citizens of North Carolina with about chiropractic and how its effectiveness in our state of North Carolina. We have nearly 6 million residents in North Carolina, and there's one person who's in charge with an office of over 400 people, and that's Commissioner Wayne Goodwin, and he works in the Raleigh area. Commissioner Goodwin is a UNC graduate in Chapel Hill and also graduated from law school. He is a local Hamlet resident and a Richmond Raider. And for nearly 4 terms, he has served in the House of Representatives for Richmond, Scotland, Montgomery, and Stanley County, and was the assistant commissioner for many years in 2005, and then was elected commissioner of the Department of Insurance in 2009. I should say that the commissioner has worked to reduce rates and is responsible for almost $800 million of surplus in the coastal property insurance pool in North Carolina. In addition to that, refunds totaling $50 million were delivered in 1 to 4 drivers in North Carolina, reductions in workmen's compensation rates, $115 million for North Carolina residents and businessmen, and Blue Cross and Blue Shield returned $155 million to nearly 215,000 families in North Carolina. So the commissioner has been an advocate of fairness and has certainly done a fine job as the insurance commissioner. Good morning, Commissioner.
Pleasure to join with you again.
You are on the road. You are always traveling on the road to all the 100 counties in North Carolina.
This job involves not only saving people money, but traveling across the state. And today I'm headed to Carteret County and the beautiful coast of the state.
Yeah, it's a big job, and like I said, Commissioner, over 400 employees in your department. You cover a lot of ground, and it's a major role. We were talking about the impact of the exchange on North Carolina, and a lot of people don't understand how this will affect their lives. What is the exchange, and how the national insurance debate affects North Carolinians? Can you give us an update?
Sure. Part of the federal law, and again, no matter how one feels about various components of the federal law, one part among several that has broad support is the concept of making insurance information available so that consumers and families and small businesses can be empowered with information and basically choose insurance plans that are more, more in tune with their needs, and they can compare plans like apples to apples. Here's the best example, Dr. Nelson, is that I know a lot of your listeners have no doubt flown on an airplane, and they may have ordered their tickets online. And when you order your airline tickets online, you can compare airline to airline and dollar for dollar. You can choose your seats, you can choose your food, choose how many stops you make, and all those other sorts of things. It's a company-to-company comparison, apples to apples. And what this exchange does, the concept that has support from conservatives, moderates, liberals, you name them, is that it gives people information that they can choose between health insurance carriers. They can choose a plan that suits their pocketbook and be able to really compare things one-on-one. And I certainly wanted the state to have the exchange instead of the federal folks, but we're still working on that, getting the state to set one up itself.
I know one of the biggest obstacles you have, Commissioner, is the challenge to your seat. A lot of times the commissioner is challenged and lobbied for higher rates. One of the things that I'm sure you're most proud of is North Carolina ranks 46 out of 50 in the lowest car insurance in the country. And I know that you're constantly lobbied to raise those rates, and that's got to be something you're very proud about for the citizens of North Carolina.
Yes, indeed. In fact, every year or two, there's a constant assault by many of these out-of-state insurance companies to raise car insurance rates. And, we have not only on the national level, the rankings have us between 5th lowest and 8th lowest, but in the South, we have the very lowest from Delaware to Texas, and that saves money for families and for small businesses. And And, and as you said a while ago, one of the first things I did as insurance commissioner is that I rolled back the rates to what they were many years ago, froze them, ordered refunds of $50 million to 1 million drivers in the state, and then had savings of about $545 million. So I want to do our best to keep a system that's keeping our rates low and protecting consumers while still giving folks options. We have tons of insurance companies who are competing here to write your car insurance, so it's a win-win for us all.
One of the things is the role of competition. We see that with regards to insurance, auto insurance, where you can shop for the best policy with the best benefits that you feel is necessary. And one of the discussions in this healthcare debate is the role of competition, which hasn't been, you don't see it as much in the healthcare debate as you do in the insurance debate. Isn't that one of the factors, one of the things that can help to lower healthcare insurance costs to our states?
That is exactly right. More competition helps lower rates, and I was looking at the data just a little while ago. Is that unlike car insurance, unlike homeowners insurance, and unlike life insurance, there are hundreds and hundreds of companies writing that type of insurance. In North Carolina, you can count the number of viable health insurance carriers on two hands, and if we're able to bring in more competition on health insurance, then that could certainly would give more options and give better rate options as well for our families.
With regards to the impact of the health care insurance, what are the mandates now on North Carolina? Have they actually gone into effect? I know it's an election year, and I know things can change. But what is expected of North Carolina with regards to the national health care plan that people may not understand?
Well, when the U.S. Supreme Court ruled in June, late June, it upheld the federal health insurance law. And even though it has some components in it that folks don't like, there are components that people like across the board. And some of them that have come into effect include not allowing pre-existing conditions to prevent you from getting insurance coverage. That is something which is being allowed to occur in a graduated fashion. Right now, you can't. Insurance companies can't keep kids off of health insurance because of a pre-existing condition. And within the next 18 months or so, I believe that then adults cannot be prohibited from getting insurance coverage because they had a pre-existing condition. Another item that is kicking in, and this has been very popular as it's been rolled out, is allowing families the option of keeping their older children on their family insurance policy through age 26, and that helps lower insurance costs for the family and certainly for that young adult. And there's some other things too involving wellness and prevention that are being rolled out, but it'll take several years, assuming that Congress doesn't change the law and assuming there's not a change in the interpretation of that law.
One of the things that we've talked about before was your impact on auto insurance, and yet the states really don't have the same sort of regulatory power that you have with regards to auto insurance and some other the insurance that's offered in our state. Isn't that correct, that the more that the states have a right to try and address this issue, the better off that the citizens of North Carolina will be? Yeah,
that is correct. To me, this is not a partisan issue. It's just the right thing is to have states be the regulator of insurance and not the federal government. Whenever the states have regulated insurance, we've been able to help respond more quickly to consumer concerns and complaints. And in fact, my office fielded 80,000 calls last year, and we were able to recover over just last year alone about $20 million for folks. And of course, over the last 4 years, in general, we've been able to help save $1.4 billion. But I guess my main concern is that where possible, we need to preserve and maintain state-based insurance regulation because it helps keep rates lower and it helps give quicker remedies to people who have complaints.
One of the other accomplishments in just a short while that you've been commissioner was the $800 million surplus in the coastal insurance that helped subvert the statewide homeowners insurance crisis. Can you tell us something about that?
Sure. My number one goal whenever I was elected in 2008 was to address the ticking time bomb of coastal homeowners insurance on the coast and on the beach, and doing so in a way that was as fair than the system that there was, while also not being unfair to the rest of the state. I was able to persuade the legislature to make some changes, and through those changes, we were able to help build the surplus in the beach plan, which is the wind pool for folks who need help with coastal insurance. And that surplus was built up by another $800 million. And then also I was able to persuade the legislature to adopt a system where if we ever have another major hurricane of like Hurricane Hazel type, the kind that came around back in the 50s, the biggest one that ever hit the state, that it would make the insurance companies responsible for an additional $1 billion of recovery, even if the beach plan surplus gets wiped out. And there's some additional protective measures there too, where all of North Carolina would help hurricane-stricken areas to rebuild. If we ever have that major storm. So one other thing I'll mention too is that, and this is historic as well, in addition to that legislative change, I ordered that the insurance companies cough up another $16 million that they had inappropriately taken from the reserves that homeowners have for their insurance coverage. So every way possible, I'm fighting for consumers, I'm fighting to save folks money, and I'm fighting for you.
You know, there's been a lot of discussion about regulation, and certainly in these cases, you can see where regulation works for the people and the citizens of North Carolina. Certainly, there's been a decrease, like we've talked about, in overall insurance rates, and a continued decrease in auto insurance. The department has been around since March 6, 1899. And 24 years, Commissioner Jim Long worked for the citizens of North Carolina. Commissioner, you were the assistant under Commissioner Long, and tell us a little bit about Jim Long.
Well, he was a fine man. He served 24 years because he earned the trust of the people of the state and the voters of the state, and he valiantly fought for consumer protection and for reasonable insurance rates. And, sometimes he'd win, sometimes he wouldn't win, but he always was fighting for all of us. And I was very blessed to be able to work with him first as the Assistant General Counsel, basically as one of his attorneys, and then particularly as Assistant Commissioner, worked at side by side with him. And I think that's another reason it adds to my background to give, I think, consumers more comfort as our insurance commissioner. You got somebody, I have never worked for an entity that is regulated by the Department of Insurance, and I think that is important that people have trust in and faith in their insurance commissioner. There are a lot of states where the insurance commissioner is somebody plucked right out of the insurance industry, and, that doesn't hurt. I mean, that doesn't hurt the insurance companies, but it certainly hurts the public when you got somebody who is a voice for the insurance industry making decisions instead of somebody like me who represents the people and independent. So, and I appreciate as well, like independence, the work of our chiropractic experts and professionals and physicians. Y'all do tremendous work to provide the independent counsel and care and recuperative needs of patients. And so we're working to help people, both you and I.
Okay, Commissioner, can you hang on for a few more minutes?
Yeah.
We'll be right back. This is Dr. Nelson. We're talking to Commissioner Wayne Goodwin with the Department of Insurance. He is the commissioner, and we'll be back after these messages. Nelson Chiropractic Centers is your first stop following a car accident. No waiting, minimal paperwork, and doctors and staff that put you first. Pick up the phone and call Nelson & Nelson Chiropractic Centers. We don't just say we care for you. We prove it in everything we do. Now, take it away, Debbie. Nelson Chiropractic Centers. We care for you. Monday morning. Dr. Nelson at Nelson Chiropractic Centers, talking with Commissioner Wayne Goodwin. He is the Commissioner of the Department of Health Insurance and also auto insurance, homeowners, life, bail bondsmen, adjusters, and business entities, including all the insurance companies, are under the Department of Insurance. And Commissioner, of course, I've got to ask you about chiropractic and our role in the healthcare, the affordability of healthcare. We've discussed this before, but your position as far as the importance of chiropractic and what it can do to effectively help to lower costs. We've talked about this time and time again about how chiropractic is just a small percentage of budgets, but yet it does work to reduce the amount of surgeries. It does work to help people to avoid expensive long-term hospitalization and rehabilitation, especially with regards to low back pain. And your thoughts for our listeners.
Well, Doctor, you're exactly right. And even before I became insurance commissioner, as someone who was representing injured folks, whether in the workplace or whether due to other accidents and the like, I regularly was pleased by the chiropractic care that my clients received, and then later I see that consumers receive. Chiropractic care is a very cost-effective and provides a relief and remedy for many patients, and it's something too which I think it's so important that insurance companies recognize is that when you have care that provides relief or remedy or could very well provide a cure in some ways by curing the pain. It's something that should be covered, and every step of the way, I've been there to help ensure that our families that rely upon chiropractic care can still have it covered by their insurance, and I would like to see there be more coverage because you provide tremendous service and value to your patients.
The old adage, that an ounce of prevention is worth its weight in gold. We see this and the impact of chronic disease on our healthcare system. Prevention is such a small amount of the budget, yet it's hardly ever mentioned when it comes to this discussion over healthcare cost. And wouldn't you agree that the amount of time vested in preventing the long-term disability, preventing disease, preventing musculoskeletal degeneration that leads to long-term disability, aren't these some of the ways that we can incorporate change and actually lower costs by providing such services?
That's correct, and when done universally, talking about all the parts of the body, whether it's musculoskeletal and what have you, if you could help determine a problem and resolve it early on, you save money, you save time, and you could very well improve the life and lifestyle of that particular patient. A lot of the concerns a lot of the impact that is having on the cost right now is due to items that that could be prevented. A lot of whether it's obesity or whether it's poor posture or whether it's not eating correctly and the like, or not having musculoskeletal matters looked into and resolved early on. Those do have an impact on the cost. If you catch it early on, and particularly with preventive items, then it saves us all money and keeps our rates in check.
They say that the ongoing cost to Medicare and also Medicaid are the things that are really going to crush the budgets, and how Medicare and Medicaid is effectively driven in the states. But chronic disease is probably at the top of that list. Isn't that driving the cost of such programs through the roof?
Yes, it is, and that is why when we look at the grand scale of things, when you multiply the cost by the number of people who are either in Medicare or who are going to be entering the Medicare system soon, it's staggering. So, saving small amounts to us individually on the grand scheme of things is a massive amount of savings for all of us.
Well, Commissioner, we know you're busy. Before we let you go, we'll have to talk about the Richmond Raiders, your alma mater, and their season this year.
Well, I obviously enjoy high school football, and as all of us do, it's always good to stand behind your alma mater. The Richmond Raiders have had a strong history of great football teams, but there's some terrific schools as well in the region that are very competitive. So I'm anxious to see how how the season winds up. But I'm always a Raider fan, but I'm just happy to see so many young and healthy athletes out there fight for their school and enjoying the game.
Well, they give a heck of a time to the Cumberland County schools. It's always a crowd favorite whenever the Raiders come into Cumberland County. And on that last thought, we'll let you go, Commissioner. We know you're back to work. Commissioner Wayne Goodwin, we want to thank him for calling in this morning.
Thank you, Doctor. It's a pleasure. Be happy to be with you.
Thank you, and have a good afternoon. That was Commissioner Wayne Goodwin. He's the Commissioner of the North Carolina Department of Insurance. You heard his thoughts about health care and about prevention and the importance of maintaining prevention in the system, try and lower the cost in health care. We want to thank him for taking a few moments out of his busy schedule to call in today to News Talk 640 Talk Radio. You know, chiropractic is a very small percentage of the budget. And what I tell people all the time is if you add up the amount of savings, you know, when patients seek chiropractic care, normally they're at their wit's end. It's usually a last stop, believe it or not. And with regards to just back pain alone, the savings is astronomical. Think about the average cost of prevention. And a typical example would be somebody that enters your clinic with a lower back complaint, possibly a disc herniation or a disc bulge. What are the options for that patient? I just had this discussion the other day with somebody that I met out at the grocery store who tracked me down and wanted to discuss their disc injury. Well, she's already had back surgery, and that resulted in 3 months out of work. In addition to that, she had at least 6 to 8 weeks of physical therapy and rehab. And yet she's still having some of the same conditions the same symptoms that she had prior to the surgery, which was pain down the leg and shooting pain into her calf. She's actually looking at a second surgery. So what are the costs of this avenue of care? Now, I'm not saying that all back surgery is bad. Certainly there's instances where it is effective. But a lot of times the research will show that back surgery for acute low back pain or acute sciatic pain is not cost effective. The other option would be conservative care, would be traction, adjustment, manipulation of lumbar spine, reduction in weight, exercise, stretching, and some of the preventative means like decompression of the spine. There's a wonderful new technique that chiropractors are employing called spinal decompression, and it's showing its effectiveness in treating low back injury, especially with regards to disc injury. The disc is mostly comprised of water, and given the right rest and the right treatment, often that disc can heal. What do you think the cost is as compared to low back surgery? Even a 3 to 6 month program, which may seem like a lot of time, but remember, we're not utilizing any drugs, we're not utilizing any surgery. We're working with the body to mobilize the joints, take the pressure off the disc, alleviate stress to the lower back, and get the patient back on their feet. That's the goal. Now, the same goal you'll find with surgery, but the cost is astronomical. We're looking at $20,000 to $30,000 as opposed to a few $1,000s on the option with chiropractic. And this goes on with neck injuries as well. So what is the role that these preventative means have in our system, and how can they effectively change the way we think about things? Isn't it better to choose a less course of invasiveness first? Wouldn't you think if you were suffering from low back pain or neck pain that you would choose something that was less invasive and more affordable first? That's the way I would think. And for millions of Americans that have sought chiropractic care, this has definitely been an effective form of treatment for them. And we know that the ongoing struggles with health care and the cost of health care are going to cripple our society. Our economy is basically having struggled for the last 20 to 30 years. This health care debate has been at the top of the page. It's been at the very top. Each and every new president has talked about health care coverage. And the problem is that today, a lot of this is the affordability, is the access of patients to seek alternative means of care. And of course, I'm a chiropractor, and of course, you're going to hear me be an advocate for prevention. You're going to hear me talk about trying to find a new way of approaching our healthcare system. Every doctor I talk to understands the importance of diet, nutrition, exercise, and alternative medicine. That's what I think people should focus on. When it comes down to healthcare debates, let's try and figure out solutions to the problem, and let's try and be open-minded to inclusion of different forms of care. I've said this before. How would you like to have in your healthcare network a chiropractor, a massage therapist, a physical trainer, right? A dietitian, a nutritionalist, a general practitioner who is focused on homeopathic remedies? How would you like to have that incorporated into your healthcare system? Can you imagine if you could go to a facility where you could have it under one roof and you could be treated like that as your entire body? Trying to figure out what the problem is. We just heard the commissioner talk about the escalating cost to our healthcare system. Well, the first thing you have to do in treating diabetes is do what? Address the problem. And what is the first thing they do? Diet. Focus on diet. Right? So these are some of the things I think are going to help our system. And we'll be back to discuss more of these. Email me at www.NelsonChiro.com. It says Ask Dr. T. And pose your question to me, and I'll read it on the air. I won't say your whole name. Just give me your first name, and we'll add that. It's been a pleasure here at WFNC. We'll be back next Monday morning at 9 o'clock a.m. I want to thank you. Have a great day, and we'll see you next Monday. Have a great day, everybody.
Hi, Dr. Nelson at Nelson Chiropractic Centers. Why are we so involved in high school football? You see, it was 30 years ago that my high school football coach's best friend was a chiropractor. A few of the guys on the team had some problems. We went to the chiropractor, and guess what? We got better. That's why I understand how important high school athletics are and how important chiropractic is to that formula. Nelson Chiropractic Centers working overtime to make a difference in our community. Hi, Dr. Nelson at Nelson Chiropractic Centers. What are the 3 most common conditions that soldiers complain about returning from war? Neck pain, back pain, and headaches. 3 of the most common conditions treated by chiropractors. Chiropractic spinal manipulation, adjusting and reestablishing joint function alleviates neck pain, back pain, and headaches without the use of drugs and surgery.